Alright, welcome ladies and gentlemen to Mr. Moore Podcast. We have a special guest in the building, Mary Elizabeth Moore. I'm going to let her tell her story and how she got into nursing and everything. Well, not in nursing, but the nursing field of helping people and whatnot. We're going to talk about the Heimlich maneuver and whatnot. We're going to talk about the CPR and how important it is.
Okay, what's up, y'all? So, right now I'm a CMT, certified medical technician, and with that, I just pass out medications to patients at my job. It's pretty simple. I have a better understanding of pharmacology, and that'll be helpful once I do get into nursing school.
Cool. So, I know I was talking to you earlier about the football player that almost died on the field and they was able to revive him on the field. So how important do you think CPR is out there in the field when it comes to saving lives, and not only how important it is, how it can save lives?
CPR is very important because you're reviving someone, you're returning them back to life. And there is classes in Kansas City that you can take. It's called Red Cross. $75. They teach you how to do the Heimlich, and they teach you how to do compressions on somebody's chest from an infant, a child, into an adult. So.
Cool. So you said what, 25?
It's 25 to 30 compressions to the chest and 2 rescue breaths. You breathe into their mouth, and then once you do that, you go back to doing 25 to 30 compressions to the chest.
Okay. What about babies? If you're trying to save a baby, how would you do to save a baby?
I believe that's 15 compressions, and you just do with your fingertips on their chest instead of using force as you would do with an adult, because their chest is very sensitive, and you don't want to break their ribs because they're still a child or baby. So.
Okay. What about the cracking of the ribs and everything when you trying to revive somebody, because you're trying to give oxygen back to the brain so they won't die or whatnot?
So with compressions, when you're doing compressions with an adult, you do have to hear the ribs crack, because that's how you know that you're pumping the heart. So if you're not hearing the chest crack, then you're not doing it right.
Oh, Jesus Christ, that sounds painful. It might be painful, but this is what you have to do to save somebody's life. So what got you into nursing or whatnot? Or let's talk about the school you went to. You went to a historical black college. Was it easy to go there? Was it hard to go there? Did you make friends when you went there? And do you miss it a little bit?
I do miss it. Only thing about HB, like switching from high school and going to college, my high school was on a very low level. So whenever I ended up going to college, their level was higher than Ruskin's. And so I feel like I was extremely behind, and I didn't understand what was being taught in class. So it was kind of discouraging, because I had to get like a lot of tutors just to catch up and figure out what was being taught in class. So yeah, it was hard to understand what was going on.
That sounded like a pretty interesting experience. So did you make any friends along the way at the Black Historical College? What was the name of that college again?
I went to Langston University, and I did make a lot of friends there. I went there in 2015, and I still keep in contact with the friends that I made there to this day.
Oh, that's what's up. That's super cute. So how far? So what is your title again?
I'm a CMT.
CMT. Okay. So how far do you want to go when it comes to the nursing?
I want to make it as far as a registered nurse. I know, you can start off as a CNA, move up to a CMT.
She fussing, boy. Oh, really?
She said, "Man, get this pacifier out of my mouth." And this is Amaya. This is my daughter, y'all. So a lot of people start off as a CNA. That's a certified nursing assistant. You're just assisting the nurses. You're helping them out.
She got something to say about all that.
So yeah, they have the CNA, the CMT, LPN, and RNs.
So how far you want to go up on the ladder or whatnot when it comes to the nursing or whatnot?
Hopefully an RN. If I get accepted to nursing school, that's the top goal for me. Their salary is $50,000 a year or more if you do travel nursing.
So what would you say to the young people out there that want to get into the field and probably discourage or whatnot? Because I know you had your mother that was in the that's in the nursing field, and her mother, your grandma or whatnot, was in the nursing field. And then you read about the lady in the history books that was a nurse. So you got history on it. You did your research. So what would you tell the young folks out there that want to get into your field so they can help people? Now, well, hold on. What about the experiences that you had at your job? You know, with people passing, you getting close to them, and what about the COVID-19? COVID-19. I know you had to work in epidemic or whatnot. Was you kind of scared going back home after leaving work, working around all the sick people?
So when I first got my CNA, it was during the pandemic, so I didn't really know what to expect after I was finished with class. And with that, I did see a lot of patients that I grew a relationship with pass away from COVID. I remember walking into one of the patients' room to check on them, and she was deceased. She was gone, and I don't know how long she was gone. It was the beginning of my shift, and I was trying to check her pulse, and there was no pulse. And with that, she was DNR, do not resuscitate, so I couldn't do CPR on her because she didn't want to be brought back to life.
So that was on her paperwork. If I'm like that, just leave me alone.
Yeah.
Man, that's crazy. So you had some bad experiences at the places that you work, doing what you do or whatnot. What about the good experiences or whatnot?
Building relationships with people that I work with. I made a lot of friends in the CNA school that I went to, and I still keep in contact with them. So that's pretty good.
All right. So you got good experiences, bad experiences.
And the only advice that I would give to anybody that is interested in the medical field, I would recommend to be a CNA first, just so you can get your feet wet to figure out if this is something that you want to do.
Man, that's crazy. And I know that CPR thing is kind of real out here. If you don't know CPR, you probably should. If you don't know the Heimlich, you probably should. What you tell? I know we was talking about the football player that almost died on the field and he was revived, and I know you was talking about how to do it or whatnot. But what about the Heimlich? If you like choking, I heard you had an experience with that when you was actually choking on something and you almost died.
Yeah.
And your mother's sister is a nurse too. Well, she's in the nursing field.
Yeah, she's a nurse.
And why don't you tell us about that experience and what happened to you that day you almost died?
So basically, she's falling asleep. I was in Oklahoma, and I was eating some steak, and I ended up choking on the steak. It got lodged in my throat, and my mom at that time, she didn't know how to do the Heimlich, but my aunt did. And so with the Heimlich, you stand behind the person, and then you like press up against their stomach until whatever's lodged in their throat comes back up. And so I was choking for at least like 15 to 30 seconds, and she ended up saving my life, and that was pretty traumatic. And that's another reason why I was interested in the medical field. Just being able to save somebody's life and having knowledge of reviving someone or helping someone being able to breathe again.
So it's like, that was very traumatic.
Very
traumatic experience, almost seeing somebody, I wouldn't say dying or whatnot, but starving for air or whatnot, trying to get air, can't get air, want to get air, panicking a little bit, and she just got up, went over there very patiently, did what she had to do. The big old piece of steak flew out your mouth, and everybody was relieved. It kind of messed up the whole weekend for me though, but I was happy that you were still here and doing well.
Right, in that situation, when you're trying to save somebody's life, you can't panic either. You gotta be able to stay strong for that person and try to revive them. So yeah, it's crazy.
So it's good to know CPR, 25 compressions. I'm learning a lot today too, y'all. You said 25 compressions
And,
on the chest,
yeah.
and if you don't hear the ribs cracking, kind of or whatnot, that means you're not doing it right or whatnot.
Right.
That's crazy. That's crazy.
They call it 25 too. So 25 compressions to the chest and 2 breaths in their airway, because you have to breathe for them as well.
Amazing. All right, so how is motherhood and everything? I know you out there doing your thing and everything. How does it feel to be a first time mom?
I wish they had a manual to figure out how to do things. It's a lot in the first few weeks of becoming a mother, because you come home from the hospital with this baby and you don't know, like, you figure out what to do next. So it's pretty crazy. They don't tell you how clingy your baby gets when they're breastfed. She's very attached to me. She knows my scent, and she wants to be around me 24/7. So that's how it is right now.
So what about being depressed after you have your baby, or postmortem depression or whatnot? Is that what they call it?
Postpartum.
Okay, talk about that.
So I know a lot of people, they do get baby blues, and they last for 2 weeks after you do give birth. That's normal for everybody, every mother. They also, some people do get postpartum depression that can last from a week to years. So it just really depends on that person. It depends on that village that you have. If there is someone that's able to help you take care of the baby, that helps, that plays a factor too. There is a lot of single mothers that do have postpartum depression because they don't have that help. And I thank God for my village, my parents, my boyfriend, his mom. They've all been there since day one, so that helps with postpartum depression as well.
And that's what's up. So you went through a little bit of it, huh?
Yeah, I went through a little bit of it, only because I didn't know how. I didn't know how to change a diaper. I didn't know how to get her to calm down when she was crying. Just things like that, not feeling like you're good enough in that moment. But I know what helped me get out of it was just praying myself out of the depression that I was going through at that time. So, yeah.